We've covered it long back on reflux. It's a very, very common problem. People have heartburn, and because of heartburn, a little bit of acid goes in, and then they're clearing their throat all the time, and then they're getting different, they're getting recurrent lung infections, or they get wheeze, etc. We work them up with something called a 24-hour study, which will tell us how much acid is going backwards, ulta, as instead of going downwards. And if we ascertain they have more than a certain amount of acid exposure, that they're high risks for cancer, etc., we will then go inside. As I demonstrated, the sutures were actually tightening or repairing the valve that's gone awry, the valve between the gullet and the stomach. And then by tightening that, we prevent them from having reflux, we prevent them from eventually from having cancer.
How old was the patient?
That particular patient is 45.
So what do you call this procedure?
It's called a laparoscopic anti-reflux procedure, or if you're American, laparoscopic anti-reflux.
It's there in the press release.
Anti-reflux procedure.
We've covered it.
And the
Oh, you've covered it in that.
You said to put that one.
Yeah, that's right. That's right.
The second one?
And the second one was a lady whom I'd done a bariatric surgery for earlier. She was a diabetic, she was a hypertensive, and she was this big. And some months ago, I did her at a workshop elsewhere in Trichy. Patients are poor, we take them for workshops because we're supposed to demonstrate. All the instruments are free, so it's cheaper for patients. So I've taken her from here to Trichy, and we operated upon her, and already she's lost her diabetes, lost 15-20 kilograms in 2 months, and lost her hypertension. She's absolutely fine. Only thing is, one of the ports that went in, with which we operated, when the ports were removed, you're supposed to stitch it close. If you don't stitch it properly, it can give a hernia from there. So she had what's called a port site hernia. So we repaired that, not laparoscopically, but open today. Incidentally, she also developed another problem in her belly, namely she developed gallbladder stones. So today we removed her gallbladder stones and corrected her port site hernia.
Gallbladder is totally disconnected from that earlier procedure.
That's correct.
It does not